Wow. Just wow. I'm gonna do a video on this now. In the 1970s, the FDA approved the medication Lithium, which is primarily prescribed for bipolar disorder, manic depressive states, mania, acute mania, long term, you name it. But the whole point to this is we're going to look at the most important facts about lithium and what you need to know about lithium in general. Because the thing I will say is it can be easy to have, for example, an acute overdose of lithium if not taking as prescribed by the doctor. Let's jump right on into the video. Like and subscribe. You know what to do, or even leave a comment. Let's jump into it. Also, a little bit more background information. Although lithium is approved, the way it works is still not completely known. But one thing researchers do believe and can agree on for the most part is that it does affect your dopamine and potentially your serotonin levels in the brain, which will help reduce the amount of stimulation the brain feels, which that is why it can help somebody who is in a manic state, reducing that stimulus of the brain. I wanted to start with that. But first and foremost, typically, for example, when a patient comes into the psychiatric setting, typically lithium is not a first line treatment a lot of times unless they come in on the medication. Because one thing I will tell you about lithium is, and you should know this if you are taking this currently, this is not a medication you stop abruptly unless of potential acute toxicities or even a potential contraindication with other medications. But never stop lithium abruptly. Always talk to your healthcare provider. And also, this is just information I'm giving you from what I've seen working as an RN in the psychiatric setting, and this is just education. Always talk to your healthcare provider. Now, first and foremost, let's say someone has just started the medication, right? Some of the common side effects at first. And typically, I will say headache is number one, for sure. Also, I will say this, if you are taking or you're considering taking lithium, if you can't be poked with a needle due to having to get your blood test done, then this might not be the medication for you. And also with what comes with that, getting your having to obviously get blood test and whatnot, at first you've got to get them more frequently just to make sure you're within that right range, which typically a lithium level, which is considered normal, and I'm just going to talk adults here because that's what I work with today, would be somewhere between 0.6 and 1.2. Very, very narrow range with lithium. And if it goes in or without of this range, this is where this toxicity can come into play. But I'm fast tracking a little bit, but once again, let's go back to some of the side effects if you first started taking it. Headaches, diarrhea or GI distress is another big one, common occurrence. And I have surprisingly seen patients who have, a lot of times it's diarrhea, but actually constipation at first. Because a lot of times, remember, they're in the psychiatric setting, a lot of times just being out of your setting and being in even a different type of bed and whatnot can cause GI distress. So it can cause constipation, but diarrhea, very common as well. Also, huge dry mouth. Water. You'll want to drink water. However, this is where you talk to your healthcare provider about it, because if you're overhydrated, you don't want to flush the medication out of your system, which can lead to you wanting to take more and potentially cause an overdose to an extent. But this is where you talk to your healthcare provider about that. But yes, dry mouth, very common. So this is something that if you already have, let's say you're taking a medication, let's say you're taking an antidepressant, an SSRI, so let's just say Prozac or Zoloft, right? a lot of times dry mouth is common with it. So if you're taking another medication with dry mouth, like lithium, which this is a very common side effect, this a lot of times can be one reason why patients stop the medication, and do not like it, or stop even abruptly, sometimes, which you should not do. Also, hand tremors, shakiness, I have seen some, but it's not something that I have seen in the short term. It's more long term. The only time I would see something like shakes would be if they're potentially overdosing on the medication. So let's say a potential patient comes into the intake department, you ask them what they've been taking because they're profusely sweating or shaking even, and let's say they say alcohol. And here's one of the big reasons why I do this video. Let's say they say, oh, alcohol. And from there, you go any other medications and they can't tell you. Let's say they were taking something like lithium to it. Alcohol can increase toxicity, surprisingly, to a lot of things. Also, when somebody is actively using things such as methamphetamine, heroin even, strong painkillers like Oxycontin or oxycodone, or hydrocodone, things like this, there are contraindications, but a lot of times patients are taking it. The doctors will prescribe it because of how it is helping them, but there are a lot of contraindications to lithium as well. Very, very important to know. And a lot of times you're going to have to do a lot of this digging for info before you go into the doctors, because a lot of times they're going to tell you straightforward the facts on why they're prescribing the medication, and they'll typically give you like a pamphlet or whatnot, but they'll tell you, for example, once you start, do not stop this abruptly. If you notice a change in, like, you start sweating profusely, headache, feeling overwhelmed on it, a lot of times always call the doctor to make sure you're not going through toxicity, things like this. This is what the psychiatrist or doctor will be telling you. So a lot of times these things like is specific signs of acute overdose, meaning let's say you take your medication, you forget it, and you double up on it, which happens a lot, surprisingly. It can. I mean, you take your medication, you question if you took it, an hour later you take another one. But this would be a situation, especially with the tremor. A lot of other things, if somebody's overdosing, from the 2 times I have seen it actually actively overdosing, they were both polysubstance users. It was one person methamphetamine, another person heroin, but that's beside the point. But with this though, the unbalance and uncoordination which comes with a lot of times overdosing on things, you add lithium to it and you're uncoordinated, sometimes it can be missed. So somebody could come in and they could start seizing, for example. Seizures is another sign of overdose from the medication. Somebody could come in, they could start seizing, you think it's alcohol, that potentially, let's say alcohol detox, that could be doing this. But once again, you don't get that medical history, for example, or you miss something like that, and it was really they were taking lithium, but you never had that on record, and they've been missing doses of that. So this is why the biggest key point of education I can summarize with lithium is take as prescribed. Don't double dose on it. Don't miss doses on it. Also, when you first start taking it, realize dry mouth is very common. Also, so there can be some sweating changes and whatnot. Body temperature changes at first, but if they're extreme, you'd want to report that to the doctor. And also with it, I will say what comes with this, GI distress is very common. Now let's say you're taking it, once again you take another dose and you're and you potentially could be overdosing. What should you be looking out for? If you are confused, any confusion right away, call 911. If you have somebody there, tell them you're confused, and educate them about this as well if you're potentially taking lithium, some of these facts. But also the biggest thing is, once again, always you have to look at medications as, yes, it can be helping, which medications are a great thing for people. They work in ways that, none of us a lot of times we look, for example, we look at somebody taking a medication, and people can be judgmental. Oh, you're taking that for depression, or you're taking that for whatever. And then they try to give that person education, and it's like, what I want to tell people is, it's like, bro, I know this stuff. You don't need to tell me why I'm taking it. So never let that stigma of the medication turn you off. Always do your information, always do your researching. If a doctor's recommending it or they're not, talk to them, because you are the patient. And if you've tried other things and they're recommending it, always, once again, do your research. But this video, once again, was all about lithium. I know I was kind of everywhere with it, but I wanted to do this just because there are a lot of times patients report having a lot side effects, just like with any other med. Not always, but a lot of times them being from lithium. Seeing that a lot recently. And also, once again, just education, because I even know something like this, talking to you guys, if somebody takes lithium or whatnot, I know for fact that doctors give you the information. And I'm not saying there's doctors on YouTube you can find this on, but I'm saying your provider, they're seeing patients throughout the day in the psych hospital, multiple. A lot of times you have to ask them these questions on why they're prescribing it. Once again, always do your research. And I will be, once again, I know I haven't done it yet, but I will be dropping a video on methamphetamine and some of the history with it soon. I've had some issues recently just making sure that I'm not using anything that could get me in trouble or the channel in trouble. But yes, that is still in the works, so I wanted to do this. I'm also still doing 365 days of running. I'll pin that at the very end of the video in the upper right-hand corner. You can click on that to see my shorts. I'm running every day for 365 days, minimum 5K, and I'm like today 320, somewhere around there. But check that out. Also, once again, I am a psych RN. And if anyone in the future is wanting to potentially do any interviews, or if they're even just wanting to do some sort of, if they want to do like a quick podcast or whatnot, one-on-one, let me know. Just let me know, because I'm open to anything mental health wise. I like talking about everything mental health. I know that was a little bit of a tangent. But yeah, that's a video on lithium. I know it was random, but I just wanted to let everyone know. Once again, this is a medication that is common. It's a common medication prescribed in the United States, but still it's something that isn't, once again, super well understood yet prescribed, and this is why this education needs to come out. All right, that's the end of the video. Please like and subscribe. I also did get a new camera that I'm going to be using. I'm just trying to figure out the sound with it. So if you notice changes, dramatic ones, just bear with me as well on that. Leave a comment. I love you all. Check out all my other mental health videos I cover with medications and all. That is it. Love you all.